Ketan Paranjape, General Manager of Life Sciences at Intel. What do you see, or what is personalized medicine, precision medicine, as is understood in the USA?
Personalized medicine is this new kind of medicine where the patient's genomic profile or molecular profile is now combined with the traditional healthcare elements like images, health records, and now the physician is able to create a tailored treatment plan for the patient based on his or her own personal profile, as they call it. Today, if you go to a doctor's office, he or she makes a decision based on the 20, 30, 40 patients that they've seen before, so it's more population-based. But now to that, if they can add a more personalized component like the genomic profile of a patient, that's precision medicine or personalized medicine.
Okay, that sounds excellent, but there are many challenges to achieve that. And what are these challenges?
If you start with the challenges, number one is the time it takes to do this whole process. The process that people usually follow today is sequencing. So you get a whole genome sequence. You start with sequencers first. These are machines from companies like Illumina that create sequences. Then you analyze this information that's coming out of the sequences, and then you create a treatment plan for the patient. This process could take between days and weeks today. Think about a patient who has just found out they have cancer. Waiting for weeks and days is not idle for them. So how do I speed that up? Number two is going to be the cost of treatments. People say to the genomics is about $1,000, the cost of genome, but that's just sequencing. If you do analytics after that, it's tens of thousands of US dollars or euros. So how can I reduce the cost? Number three is the healthcare agencies or the governments or the insurance companies do not pay for whole genome or whole exome sequences today. So that has to change. Number four is the interpretation of the data that's getting generated. It takes a lot of time today, again, back to the time issue, and the quality of the data that's getting produced. Think about it this way, that you have a reference genome which you compare your genome against. In the world today, there are about 65, 70,000 genomes. The population of the world is about 8 billion people, 7 billion people. So you don't have enough references to do the comparison. And finally, it's the privacy of the data. So there's a lot of data that's already generated today, but that's all hidden away in data silos that no one wants to share to protect the patient privacy. So those are the 5 challenges.
So these are the challenges. So what are the solutions?
So solutions, if you look at the challenges and work backwards from that, the first one is time. So can I do all this in one day? So at Intel, we have this new campaign called All in One Day by 2020. And what that means is sequencing, analytics, and the treatment plan, which I said could be days and weeks, can I squeeze all that in one day? So anything that happens to speed up sequences, or analytics, or treatment plan in a day is holy grail. Number two is the cost. So if I can go create enough evidence and go convince the governments to pay for treatment of these plans, that's going to be success for us in the long term. Number three is interpretation of the data. So applying new technologies like machine learning, deep learning, cognitive computing helps address those issues. Number four is on privacy and protection. If I can go create a network where people are willing to share this hidden data, but again, feel secure that the information is not getting exposed. So at Intel, we're building a collaborative cancer cloud where we create a federated, secure, and a scalable environment where somebody making a query can now access data behind someone's firewall. And what that means is your information stays protected. Rather than you sending your data to the question comes to you. And the analytics happens behind your secured environment, and it's just the answers that goes back to the patient. So really speeding up the sequences of the analytics, applying new technologies, machine learning, deep learning, trying to reduce the costs or get it paid so patients can benefit from sequences because the government pays for it now, and then creating these collaborative environments is going to be the success for precision medicine.